Hi guys, Josh Tompkins here, Clarksburg Fire Department, firefighter first class. I'm also a student at Pierpont Technical and Community College in the paramedic program. Today we're going to talk about therapeutic communication. Good communication skills are an essential part of providing quality patient care and treatment. We form a general impression as soon as we can view our patient. This is the time for the healthcare provider to introduce themselves, ask the patient's name, and ask them why they called 911. The patient's answer is going to give the paramedic a lot of clues about their condition right off the bat. We'll use those clues to begin assessing the patient, including their chief complaint. That's the reason why they called 911. We can also see problems in their work of breathing. In their answer, an answer period is going to tell us that they do have an open airway. Obviously, if they did not have an open airway, they would not be able to speak. At this time, we're going to look and see if the patient makes eye contact. Do they speak? Do they answer us at all? And does that response indicate an increased work of breathing, like the patient gasping for air and only forming, one or two or three word sentences? So we've asked the patient their name. If it's correct, they're obviously oriented to person. We're always going to address the patient as sir or ma'am or Mr. or Mrs., followed by their last name. Addressing the patient as sweetie, honey, dear, extremely unprofessional, disrespectful to the patient, and one of my biggest pet peeves, so don't do it. Sir or ma'am or Mr. or Mrs., followed by their last name. Then we'd ask them if they know where they are. The proper answer here indicates they're oriented to place. Ask them to tell you what day of the week it is, what month it is, what year it is. Getting the right answer here indicates that they are oriented to time. And then we can ask them about a major event, such as who the president is at the time. And if we get the right answer there, that indicates that they're oriented to event. So all correct answers in that line of questioning is going to tell us that this patient is oriented, alert and oriented to person, place, time, and event. Or we call that A&O times 4. So what do? We are going to offer to shake the patient's hand. As we do that, we'll give them the medical handshake. That is the time when we can actually shake their hand and use our free hand to check a pulse. We're not looking to get an exact rate here. We just want to get quality and an idea. Is it rapid and full? Is it is it regular, full? Is it rapid, weak, thready? Things like that. We'll also assess the skin at that time because you are touching the patient, so we can assess if it's warm, cool, moist, or dry. And then we need to always ask for permission before we perform any kind of examination or put our hands on that patient. It's a good idea to tell the patient what we're going to do before we do it. And then another big part of the assessment is obtaining a good history. So sometimes this can be very difficult. You have an unresponsive patient. You're going to have to look for environmental clues. You might be able to get some information off bystanders or family members. And then other times we can get history straight from the patient themselves. We use mnemonics, OP, QRSTT, and then the sample, her, as a baseline to gain information about the patient and their chief complaint. O in the OPQRSTT is for onset. This is where the healthcare provider, paramedic, EMT should ask questions like, when did this condition start? Did it start suddenly or gradually? Things of that nature. And then P is for provocation. We can use questions to gain information, such as, is there anything you can do that relieves this pain? Are there things that you do that make the pain worse? or their condition, whatever we're dealing with at the time. Q is for quality. This is when the patient should be asked to describe their pain. We can ask, is it sharp and a stabbing pain? Is it a dull ache? Things of that nature. And then R is for radiation. We'll ask if the pain travels anywhere. Does it go up the neck, down the arm? Abdominal pain, does it go around the side and into the back? Things like that. Or is it localized in one area? S is for severity. This is when we are asking the patient to rate their pain. I would use something like on a scale of 1 to 10, 1 being little or no pain, 10 being the worst pain you've ever felt in your life. What's the number of your pain? And then once you get that number, you need to verify what is the worst pain that that patient has ever felt, just so that you can gauge the current pain. And then the first T is for time. We'll ask questions at this point like, is the pain constant? Does it come and go? And then the final T is for treatments. We need to ask the patient if they've ever done anything to self-treat this problem. And if so, when and what exactly. So acquiring sample history is also very pertinent information that we can use to provide proper treatment. Sample, it's another mnemonic. The S in sample refers to signs and symptoms. Signs are the things that we can see, and symptoms are the things that the patient feels. So during the physical exam, the medic needs to note all the signs, everything that we can see. And then asking the patient what they're feeling are going to help determine the symptoms. We can watch the patient's face for grimace as we palpate, and that's going to reveal where problems might be. The A in sample, that's for allergies. We need to ask the patient if they have any allergies to medications, foods, environmental hazards, like insect stings and plants, any allergies whatsoever. M in sample, her, is for medications. We'll ask the patient if they're currently prescribed any medications, and if so, have they taken those medications as prescribed? And if they have taken medications, when was the last dose and how much was the last dose? This includes over-the-counter medications, holistic medications, vitamins, and finally medications prescribed by a doctor. P in the sample is for past pertinent history. We need to question about any other medical history. Do you have or have had any heart trouble in the past? Does this today feel like that did? Ask about any problems such as diabetic history, hyper or hypotension, breathing problems like asthma, COPD, emphysema, chronic bronchitis, any history of a stroke. We'll need to ask if the patient's had any recent surgeries or has any psychiatric problem history. These are all items that we want to know about. L in the sample, that's for last oral intake. We want to ask the patient when they last had anything by mouth. It could be food or drink, and if so, what was it? Exactly when was it? We want to know about everything taken orally. E in the sample, that stands for events leading up to the incident. We want to know what happened when this started, or what were you doing when this started. Basic events that led up to the problem that we are on scene for. H in the sample, her, that's for habits. We'll ask about the use of cigarettes or tobacco of any kind. We want to ask about alcohol usage, and then any kind of illegal drug use. It's important to let the patient know that we are not the cops, because we are there to help them, and this is information that is going to help us help them. It's very important. They're not going to get in trouble by us. A lot of people may feel reluctant to give that kind of information out to anyone who's in a uniform. So you need to reassure them and let them know that we're here to help, and this is important information that may influence our treatment. The second E, the sample her, the second E stands for environment. This is where we need to scan the patient's environment, note anything that stands out. Is the place clean? Is it a mess? Are there empty beer cans and full ashtrays everywhere? Are there multiple pill bottles everywhere? We just want to take in our environment around the patient, and that can give us a lot of clues about their daily living. And then the R in the HER, that stands for risks. This is when we want to question the patient about any family history, relatives that have the same problems, and what may have happened with them. Anybody in the family with the same type of conditions, we want to know about that. So that's your basic line of questioning. A lot of these answers are going to lead you to further questions. So you really need to be a detective and investigator when you're talking to your patients. Asking the questions is not enough. An effective paramedic's going to ask the questions, but listen to the answers. Write things down, because on that ambulance ride to the hospital, there's going to be a lot of information flying around, and writing everything down is going to be what a good healthcare provider does, because they'll be able to pass that information along to the receiving staff at the ER or wherever we're taking this patient, and that may influence further treatments for these people. So it's very important to listen carefully. Also, ask as many open-ended questions as you can. That gets the patient talking, and they may elaborate or elicit some information that the medic might not have thought to even ask about. So open-ended questions allow that patient to get talking, and you can sit back and listen. Acquiring as much history as possible is going to help that hospital staff. So the information gathered should be passed along when you do your patient transfer and you give a report. You want to give all the information you possibly can get from that patient and their surroundings back to the hospital when you transfer care. So as far as history, that's about it, and look forward to the next installment. Thanks.